For this week's high leverage practice, we're going to be talking about assessment and what that could possibly look like on your high leverage practice portfolio. First, please stop and read pages 41 to 54 in your high leverage practice guide. There are only 3 high leverage practices related to assessment. However, all 3 of them are critical in teaching, especially in special education. So we do all 3 of these high leverage practices all the time and all day long. Essentially, you're going to use assessment, implement assessments to understand the student. You're going to interpret data, and then you're going to actually use the data to make instructional-based decisions. So the first one we're going to talk about is high leverage practice 4, which is using multiple sources of information to develop a comprehensive understanding of a student's strengths and needs. So in a little bit, I'm going to give you some examples of what this means, but it's really important that you don't base a student's progress or eligibility/diagnosis on only one type of assessment. It's really important to get the whole picture. We want a holistic assessment, meaning we want input from various stakeholders like teachers, parents, student, school psych if needed, maybe related arts professionals or related services professionals, We want the whole picture to really understand what that student needs, and we want their input throughout the school year. So this is not like a one-time, I'm going to write an IEP, so I need to talk to all these people. This is actually a team effort throughout the entire school year. So here are types of data you may collect throughout the entire school year and to get input from all the different stakeholders. And you'll notice the title of this slide is Student Strengths and Weaknesses. And that is so important because I think oftentimes we can get stuck in a deficit mindset, meaning we only focus on the weaknesses or the challenges of the student. And those are really important because we can help determine services and goals for the student based on weaknesses. However, the strengths I think are equally or may even be more important, because if we know what the student's good at, fluent at, comfortable with, and motivated by, that's going to help us plan really effective instruction. And so collecting data for both of those will be important for you. So here are some examples to develop a comprehensive understanding. Test scores, obviously, they could be test scores on standardized assessments that the psychologist gives. They could be test scores like on a spelling test or a math test. Your grades in the classroom, how the student's doing just day to day and all of the grades that you're collecting. The psychoeducational reports, so that's actually when the school psychologist tests the student to determine eligibility. Progress monitoring, so that might be like curriculum-based measurement data. Your CBM, that's kind of like what we do in the SLO. We use progress monitoring data and other type of data. So it could be like anecdotal, so you're just jotting down information related to the student's academic success or maybe social or behavioral. Environmental factors might be important, so the student's socioeconomic status, his or her family, the environmental factors in your classroom might be under consideration. Obviously, hugely important is student interviews and input. You should not go through the entire school year without actually asking the student how he or she is doing. Family input, and then direct classroom observations. If you're assessing in behavior and you're the lead teacher, that is sometimes difficult to collect assessment data while you're teaching, especially if it's about behavior. So you might actually ask your aide or another special ed teacher or just a teacher in general to come in and provide some direct classroom observation. So high leverage practice 5 is about interpreting and communicating assessment information with stakeholders to collaboratively design and implement educational programs. So they include this one because it would be a shame to collect really solid, valid, reliable assessment to get that whole picture of the student, that holistic assessment we talked about a couple of slides ago, and then not actually interpret or communicate what's going on about those assessments. So high leverage practice 5 is actually just suggesting or asking you to use assessment data and to communicate that with parents and teachers and maybe even the student. When you gather assessment data for the psychoeducational report, or that report the school psychologist conducts and completes to determine eligibility, you will use that information, so all of those assessment data, for your present levels of performance in your IEP for the student. So you should actually use and communicate this in that legally binding document, because again, that document, the IEP, is going to go to all stakeholders. The parents are going to get it, or the guardians, the gen ed teachers, the special ed teachers, anybody who works with the student is going to get access to that information. So it's important that that be one of the venues for how you communicate the assessment information. I want to review the information about the bell curve or the normal curve, which is the diagram you see on your screen. So when you collect the assessment data for a diagnosis/eligibility, in other words, to determine if the student's eligible for special education, you're going to be giving, along with your school psychologist, a series of standardized assessments. And it's really important that you understand how to read these standardized assessment results, and so that you can communicate that with families. So this is, again, the bell curve or the normal curve. And you'll see in the middle, the longest line says mean at the top, and then at the bottom of that line says 100. So if I am thinking about an IQ test, and these are my IQ test scores, I could get a 100, and that is the mean or the average. So the majority of the people score about 100 on the IQ test, and that means they have quote-unquote normal intelligence. They're developing typically, right? They have normal, I'm using quotes here, normal intelligence. Majority of our population scores between an 85 and a 115 on the IQ test. In fact, about 68% of the population scores between an 85 and a 115. And you can see that on the graph. There's 34% between 85 and 100, and then another 34% of the population between 100 and 115. So about 68% of the population falls within 85 to 115. So that's kind of the normal range. Additionally, you can notice the box, the blue box that I made, and it goes from 70 to 130. About 95% of our population falls between 70 and 130 on an IQ test, okay? And that is called 2 standard deviations below. So 70 is 2 standard deviations below. 130 is 2 standard deviations above the mean, in case you ever hear that vocabulary or that jargon. And so I've also noted some information in purple, and this I don't want you to overgeneralize, but I'm just trying to give you a sense of what some of these scores typically mean. So if I score in like the 85 range to 100, sometimes those are our students with a learning disability, meaning they have average intelligence, but they might need accommodations to help them. For our students who score a 130, so that's on the high range of the 95% of the population, those students are typically identified as gifted or talented, so they might need enrichment, for instance. If we go the other way on our diagram, students who score about a 70 on an IQ test, those are students with a mild intellectual disability. So if you think of an IQ of 70, that is about 3rd grade level. So we know our students with mild ID probably can operate on at least a 3rd grade level. Again, don't overgeneralize. I'm just trying to give you a sense. And then students who score about a 55 on an IQ test are students with severe intellectual disabilities. So those might be the students who really need moderate or severe profound self-contained classrooms, and they're working on a modified curriculum. Okay, usually life skills, things like that. So this is our normal or bell curve, and this is going to be really important when you work with your school psychologist to analyze and communicate the assessment results. The last thing I want to point out is the bottom of the chart where it says percentile rank. Sometimes that's called PR. But this is often really helpful when you're talking about assessments to families. So if I look at the, score of 100, the mean, that percentile rank is 50. And the way you interpret that is if I score 100, I'm in the 50th percentile, which means I'm scoring as well or better than 50% of my peers. Therefore, the higher the percentile, the better in terms of intelligence. So if I scored a 130, which means I might be gifted, I'm actually in the 97th percentile, meaning I've scored as well or better than 97% of my peers. If I've scored a 70 on the IQ test, I'm really in the 3rd percentile, which means I've scored as well or better than 3% of my peers. So often that helps parents really understand these scores and how those scores relate to same-age peers. The last high leverage practice related to assessment is using student assessment data, analyzing instructional practices, and making necessary adjustments that improve school outcomes. So again, it would be a shame to have all this data, to have communicated the results of the data, and then not to actually use the data to make instructional-based decisions. So high leverage practice 6 is saying just that. We need to continue to progress monitor. We need to continue to adjust our instruction as needed so that we can meet the needs of all of our learners in the class. In order to progress monitor, sometimes we can use curriculum-based measurement. So those are those probes that you administer at least monthly. Often it's twice a month or maybe even every week. And CBM probes can be found at Easy CBM or Intervention Central. In the area of reading, your district might also use Ames Web. So those are just some examples of CBM. CBM is typically collected in reading, writing, and math. Sometimes it's not all three, but those are the three typical subjects that you will find CBM measures for. You might also have formative assessments. Remember, those are those informal checks for understanding, and those are important even though they may not elicit a grade at the end, but they can help you prioritize the use of instructional time to increase student opportunities to learn, to provide additional instruction, to modify delivery strategies, to refine instruction, and determine curriculum needs. So even if I'm just questioning in a class, that is giving me so much information informally and helping me identify the gaps in student knowledge that will then help me refine my instruction.